Hey there, future nurses. Today, let's talk about something you'll definitely encounter in your career and on the Nclex: caring for patients after lower extremity surgery. This is crucial knowledge that can make a huge difference in patient outcomes. Let's start with nursing care basics. Your post-op patient needs extra attention in the first 24-48 hours. You'll be monitoring circulation, sensation, and movement of the affected limb. Remember the classic 5 Ps: pain, pallor, pulse, paresthesia, and paralysis. These are your red flags that you need to watch for. Now here's the tricky part: repositioning. You might think, oh, just help them move, but there's so much more to it. First, always explain what you're going to do before you do it. Your patient's leg should be elevated above the heart level to reduce swelling, typically about 20 degrees. Use pillows to support the entire length of the leg, but be careful not to place them directly under the knee, as this can impede circulation. From an Nclex perspective, you'll often see questions about complications. The big ones are DVT, deep vein thrombosis, and compromised circulation. Here's a tip. If you see a question about a patient complaining of calf pain after surgery, think DVT until proven otherwise. The Nclex loves to test your critical thinking about post-op complications. Let me give you a typical Nclex-style question. A patient post-total knee replacement complains of increasing pain and tightness in the affected leg. Which action should the nurse take first? The correct answer would be to assess the neurovascular status of the extremity. Remember, assessment always comes first. Here are some easy tips to remember for your clinical practice and Nclex prep. First, timing is everything. Early mobilization is key, but follow your facility's protocols. Second, use the RICE method: rest, ice, compression, and elevation. Third, document everything, especially changes in sensation or movement. And here's a little trick I learned from experience. When helping patients reposition, use the log roll technique and keep the affected leg aligned with the hip. This minimizes pain and prevents strain on the surgical site. Remember, your role isn't just about following procedures. It's about being an advocate for your patient's comfort and safety. Watch for signs of anxiety or depression too, as these can impact recovery. So there you have it. Whether you're studying for the Nclex or already practicing, these principles will serve you well. Keep practicing, stay confident, and remember, you've got this. Patient positioning might seem basic, but it's these fundamentals that make great nurses exceptional.